Well, welcome everybody. I appreciate you joining us. Today we're talking about tinnitus, which is one of the more common afflictions, both worldwide and then also, as we've posted on social media, it's one of the more common disability ratings that our veterans get. So we want to talk about that, answer any questions that we can. I apologize in advance. I'm at the office today, and if the phone rings in the background, I tried to mute it, but I haven't been able to be successful. So anyway, well, let's get started. Most people are familiar with tinnitus, the sense of ringing or buzzing or hissing. It can occur in one ear. It can occur in both ears. There's not a rhyme or reason as to whether it's bilateral or unilateral, but it can occur in one isolated ear or it can occur in both. It can be intermittent, happening every now and again, or it can be continuous. Um, it can range in severity from sort of a louder ring type situation to a softer buzz or a hum. As we mentioned earlier, about 50 million people in the United States alone suffer from tinnitus. It is, as I said, one of the more common uh, disability ratings that our veterans get. It is more common in men than women for whatever reason, and it is more common as we age. Uh, Typically, you will hear people complain of a higher pitched, steady ringing sound. That's the most common kind. But you can also have variations. You can have a pulsating type sound that can change with exercise or even body position. Some have also stated that you get a clicking sound. However, the clicking sound tends to be more associated with a nerve or muscle abnormality, and I would recommend an ear, nose, and throat specialist evaluate you if you're noticing more of a clicking sound. Causes of tinnitus. So, tinnitus is caused by damage to the tiny hairs on the auditory cells within the inner ear. Um, It sometimes produces the noise that you hear that the patients complain about, and the damage to those cells or that those tiny hairs on the cells. Sometimes it's a natural result of aging, but most frequently, what we've encountered, especially in our veteran population, is noise insult. So loud noises, firing ranges, airplanes, big engines, those kinds of things tend to over time. Um, Damage those auditory cells, resulting in the tinnitus that we know. Now, sometimes the tinnitus is temporary, but more common it is a permanent, long-term thing. Again, sorry about the phone. Um, Sometimes the result can actually be more of a TMJ problem, which again, you get some have more of that clicking sound as opposed to the ringing or the humming or the buzz. So again, an ear, nose, and throat specialist might be appropriate if you're experiencing that clicking. Auditory testing can help because tinnitus is often associated with hearing loss, but in order to confirm hearing loss, you need an audiogram or a specific hearing test to evaluate for hearing loss. Again, some hearing loss is expected as we age, but for those of you who've been around a lot of loud noises frequently, especially in your service duties, it can be a result of the injury sustained from that loud noise. Treatment. There's not a whole lot of treatment options for tinnitus, short of some mechanical problems, which would be less what we would address and more what you would need an ear, nose, and throat specialist to evaluate for. Um, the focus is less on treatment and more on management and how to cope more successfully with it. And some of that gets easier over time. So, any of you who are, say, newly diagnosed with tinnitus, or you've been suffering with it for a few months or even a few years, as time progresses, you learn to manage that more successfully and, in a sense, function without it disrupting you as significantly. So the focus is more on the management side. Um, Obviously, any underlying disorders, like we talked about, again, emphasizing, the need for ear, nose, and throat, if this is more of a clicking sound and not so much that ringing or buzzing or hum. Um, If you have associated hearing loss, hearing aids can actually help. And that's something else which you may benefit from an audiogram to determine if there's a hearing loss component associated with the tinnitus. Again, the hearing loss is separate from the tinnitus. The tinnitus is the ringing. Hearing loss is a separate thing. However, hearing aids, if there is a component to that, can benefit tinnitus, which is beneficial. One of the other possibilities is medication-induced tinnitus. It is not nearly as common in the patients that I've seen, especially those of you who have been around loud noises and engines and firing ranges and so forth and so on. But if you have been on medications that run the risk of causing tinnitus, that is something else that can be managed. And sometimes stopping the medication fixes the problem. Other times, unfortunately, the damage is done. And again, it goes back to management as opposed to treatment. But again, there are behavioral therapies that you can pursue, techniques that you can pursue to help kind of manage the noise that I know can be annoying, especially if it's more constant and less intermittent. Um, Unfortunately, most people do report. I say most people, that's not fair. About 1 in 4 persons, so 25% of people do report a steady increase in the tinnitus as they age. Again, some of it is the age related that we sort of anticipate. But again, for those of you who've served around loud noises, the injury and the insult that you receive to those inner ear cells, that is what we worry about. And you may see some worsening over time, but we're talking years, not days or months. So I say that simply to caution that I would not expect the tinnitus to go away completely. Now, you may improve, um, but it may not. And I think that that's important to caution you for, so that you learn to manage it best as you possibly can, because I know it's really bothersome and really annoying, and really challenging. So the things that I think I would focus on is get a hearing test, because if there is hearing loss, there can be a benefit to a hearing aid that can also benefit not only the hearing loss but can benefit the tinnitus. Um, if you think there's medication, ask your primary physician about that and see if you can cease medicine, switch medicines, and see if that helps. And then also other management, behavioral therapy techniques to just help cope better with it, because I know that it can be very annoying, even though it's not particularly dangerous. It's aggravating and difficult to live with. So at this point, I do want to stop. I know I've been talking for almost 10 minutes straight, and see uh, who's got questions. Are there any questions specific to it? Thankfully, tinnitus is common enough that people are familiar with it. Unfortunately, it's common so that we see a whole lot of it. Um, but let me stop and see if anyone has any questions that I can answer. So the best way to get started with the evaluation for tinnitus with Telemedica is and we'll see if we can throw up the website, but get plugged in with Telemed. There you go. Get plugged in with our customer service at Telemedica, and they can get you on the schedule to be seen by a provider. And it's a pretty straightforward exam. Honestly, we can do it through the telemedicine platform easily, and ask you a handful of questions about your experience, the the noise that you hear, how long it is, things like that. So it is really a pretty straightforward process. I have anecdotally. So the question is if sound machines can help manage tinnitus. I have anecdotally heard that yes, it does help some people. That there are people who have that. Some call it white noise. You can call it whatever sort of sound sort of helps drown out the ringing. But yes, that has shown to have some benefit for some people. Yes, good question. and I realize there may not be a whole lot of questions out there, which is okay. I'm aware that tinnitus isn't one of the super complicated diagnoses. People tend to understand that pretty well, even if it is annoying. So it's okay if there aren't a ton of questions. Our real goal is to help get you plugged in so that you can be evaluated. And again, our customer service team at Telemedica is happy to get you on our schedule for evaluation. All right. Well, I appreciate everyone for joining. I hope it was beneficial. I know it was short, and in some ways, I take that to be a good thing. If people aren't having a bunch of questions, I'm hoping that it was clear. If not, don't hesitate to reach out. Even if you have questions to ask, we're happy to answer and help you in any way we can. Again, the website's listed below. Our customer service team can help get you set up to be seen by a provider, to be evaluated. It's a straightforward process. We're happy to do it. It doesn't take long at all. And thankfully, almost everyone's familiar with tinnitus, for better or worse. It is very common, so it is something that we certainly want you to be evaluated for, because it is not only common throughout the United States, it is common, very common within our veteran community. And like I said earlier, it is I think it is the most diagnosed disability. So again, thanks for joining. I'm sorry I was in the office today. Um, Hang on one sec. Yes. So I do recommend a Nexus letter if you've been denied for tinnitus. I think the Nexus letter is an invaluable part of the disability process, because our Nexus letter team does an incredible deep dive into your service history, into the connections. They have research that they do that connects dots that are incredibly important to help get you disability. So I really do recommend a Nexus letter, even if you've been denied. So, but again, let me see. It looks like that's it. But thanks, guys. I really appreciate you joining us. I hope you all have a great day. Stay safe out there, and please reach out to us if you have questions. Thanks so much.